up in Kenya, Africa, and then growing up with a sick mother, it made me want to become a nurse.
So we can answer this.
It was kind of like I'm going to be a nurse since I knew how to talk.
I would watch my dad set up the Mediset for my grandma actually. So he would help arrange all of her medications, and I remembered being really intrigued by the idea that just by being able to arrange someone's care, he was able to make a difference in her life.
It's actually my mom. Just a series of life events kind of led me to realize like I wanted to serve people.
A lot of family members are nurses in my family. My sister is nurse, my aunt is nurse.
I come from a family of nurses, so I'm the fourth in my direct family.
When my mom sick, I told her, Mom, I will be a nurse and I will be an excellent nurse.
Then you may end up going home. It gave me a sense of purpose. Like I feel going home and going to bed knowing that I made a difference in somebody's life.
It's really about taking somebody and helping them through the most difficult moments of their life.
It's something that I always wanted to do. Good morning. How are you? It's so unreal. Working as a PCA and then working my way up to a charge nurse position.
And decided I might as well travel. Why not? And I did.
You good in here?
First assignment was here at Valley, fell in love with it within the first few days. And then I either had to jump off or continue traveling, and I chose to jump off. This place is amazing, and I've worked in the field for almost 40 years.
I originally took a travel contract here about 1.5 years ago. From Boston is where I was last, and then I got this job offer. Came out 2 weeks later, and I never wanted to leave.
I have had 2 of my babies in here in the mother baby unit. My family comes here for treatment and care. I myself also if I need to, so that is home.
Our mission at Valley Medical Center is caring for community like family.
We go visit the different stations.
We're here because it's a calling, and when you have people you can share that with, it is a very precious gift.
I will tell you that I truly believe that we treat our patients like family.
Everyone here that I've encountered and have had the pleasure of working with knows how to embody that in every touch, in every action, and every smile.
I really love our mission statement. We really do treat patients like families.
I get to know the patient in a personal level. I was able to laugh with them, cry with them, cheer with them.
If I'm taking care of somebody's mom, I have a mom. If I'm taking care of somebody's parents, it always comes to my mind. I want to care for these people like my own family. Call anytime you need help.
Absolutely, people first. And again, like trying to make our communities better, trying to make a difference in people's lives. And I think it all starts at home.
We have a very encouraging culture. You feel like you're being valued.
We still have quite a few nurses that have like about 20 years or more experience, and they're resources. I always had support. I always had someone checking in with me just to make sure that I was like okay. I do see it as a second family.
I just have a great boss. I have great coworkers. We've worked together for a very long time. In fact, the last couple of nurses that have left were only because they retired.
At Valley, we have very competitive wages and benefits. Most of our departments have very flexible schedules.
There are opportunities to grow, and I think Valley's very supportive.
Right now I'm studying to take a test to get certified in my specialty.
They can access tuition funds where they can go back to school and pursue careers that they never imagined before.
Ultimately, we have to think about what is the appropriate time.
Every single person that I've met here at Valley has allowed me opportunities to explore what are areas of interest for me.
I don't want to go anywhere else. I will stay here until my career is over.
It's great teamwork here. Everybody helps with each other, and it's a very diverse hospital. People are all from different backgrounds.
Why Valley? Well, I met my people. And why nursing? Because I knew this is where I was meant to be.
And I've been in multiple facilities, all of which I've liked to some level, but this one totally tops it. I love coming to work. I don't have a fever, I'm not sick, I really am sincerely meaning that.
I wouldn't settle at an organization that didn't feel like home, didn't feel like it was a safe place to be, that didn't feel like they valued their staff and their nurses and the quality of care that is given to their patients. I've always said happy nurses mean happy patients, and this is the best I've ever seen.